Since my interviews Tuesday of this week on the topic of long-term care facilities and keeping visitors out aired. And we are now going into 4 months of this pandemic. But since earlier this week, we had been inundated with families emailing and messaging us their stories, frustrations, and unanswered questions. So we've been looking into this, and today the Department of Health came out with new recommendations for long-term care visitors after they had their first meeting on reopening guidance for all of our long-term care facilities in this state. The new guidance includes outdoor and window visits. They're asking facilities to establish a visiting schedule, do symptom checks, require masks and social distancing. I spoke with a health expert from the Minnesota Department of Health earlier today about those guidelines and had a lot of questions, not only from myself, but from the families who've contacted us. Maria King has been with the Minnesota Department of Health for more than 20 years. She's in a leadership role with the Health Regulations Division, and when it comes to answering some of the questions about rules, regulations, recommendations, and all of it, she is the person, hopefully, with some of the answers. Maria, let's start with one of the questions I've been getting a lot of, and that is, there is staff at long-term care facilities who are allowed to come and go home, come back to work, go to the grocery store, gas station, whatever. And if the long-term care facility is okay with having people, staff members, do that, why can't family members get a temperature check and get the screening and be able to visit their loved ones?
We're getting closer to that, and right now we do have guidance available for window visits to be conducted, and we also have guidance for visiting outside with loved ones at the facility. And as we move closer, we're hoping that those things will really help to bridge that gap for family members to be able to spend time with their loved ones.
There are words that keep getting used when people talk to a long-term care facility director, and they say, why can't I come and visit? Why it's been so long? And so then they keep hearing these words. It is recommended, it's suggested, it's a guideline that we're following from state, from federal agencies. Are the rules that have been put into place, Maria, are they rules that could cost a nursing facility or a long-term care facility their license? Are these laws? Are they rules? Are they recommendations? Help us understand that.
Okay, so early on in the pandemic, there was guidance that came out of the Centers for Medicare and Medicaid Support in coordination with the Centers for Disease Control that were posted and published for use in skilled nursing facilities. The Minnesota Department of Health adopted those same criteria because it was a very valid scientific approach to providing safe measures in place, and we adopted those criteria for all congregate settings. In April, there was additional feedback that came out that said that facilities had to implement those criteria. Since that time, facilities across the country are in different places as far as where their states are at, where their facilities are at with the amount of infection and COVID in their communities and within their facilities themselves. And that's where we are now in Minnesota, taking a look at how we can move forward with reducing some of the restrictions. So prior to lifting those restrictions, facilities could be held accountable for not implementing measures to keep their residents safe.